Thank you very much, people, for joining us this evening. And the Southern Tier Special Education Task Force is one of the regional groups around the state. A couple of decades ago, around the Capital Region, a group of people got together, parent lawyers, school lawyers, people who were working in special education and parents. And they thought it would be a really good idea if they could do some educational programs about the laws, about regulations, about best practices. Because sometimes when people come together at CSE and CPSE meetings, there's an awful lot of tension, and people can feel nervous, uncomfortable, stressed. And they thought it would be real helpful if people got to know each other outside of the IEP setting. That was the original thought. And they discovered that that really helped a lot. It helped a lot to give people information, especially families, but also teachers. And so they started having these regular education sessions there. And it worked out so well, they thought we should spread this idea around the state. And they did. And the Southern Tier Special Ed Task Force is one of the original groups that got started and kind of sprung off. And we've been around now for a few years, and we try to do programs 4 or 5 a year. And we always ask people when they participate, is there an area or something that you really would like some more information about? There are quite a few individuals and groups out there that do training, and we try not to compete with them. So sometimes just finding out what the task force is doing, and then sometimes they can, we can send you off and refer you to others who are doing some other kinds of training that may be very specific to what your needs are. And tonight we have Francis, Risa, and Brittany, and they are going to talk to us about some OPWDD services, particularly around family support services. Not everybody who has a child with developmental disabilities has gone through the process of going to get on a waiver. But that doesn't mean you can't get the help that you need to help your child or to help your family member. And so we're real anxious tonight to hear from Francis and Brittany about family support services. So I'm going to stop talking, and you guys, you can tell us a little bit more about yourselves, and also feel free to get started. Thank you.
Thank you very much for the introduction. Thank you so much. We're just going to wait for the slides to get pulled up real quick.
Yeah, I'm pulling them up right now.
Oh, thank you.
Mm-hmm. Can everyone see that?
Yes.
Okay, I'm going to minimize this here a little bit. There we go. Okay, so now I can see everything. So first and foremost, hi everyone. Thank you for coming today and taking the time out of your day to take part in our little crash course we're going to give you real quick. It seems to be that family support services is kind of an elusive topic. Some folks have heard of it but don't know what it is. So we hope to bridge that gap a little bit tonight. We're going to give you a brief bio on our background, but first we want to just outline some of the things that we'd like to cover to make sure that folks are sort of able to ground some of the things that we learned here today around some learning objectives that we've outlined real quick. So the learning objectives that we'd like to outline really kind of center around these 4. Now we're going to cover a lot, and we are going to have time for questions at the end. But ultimately, much of what we're going to talk about here today is going to relate to what in the world family support services are, who are they available to, why might someone benefit or pursue from family support services, and how does someone even access these services in the first place. So we will get back to all of these in more depth in a few minutes. But first, who in the world are we? How are we relevant? How do we know we're talking about, and where are we from? So my name's Francis. Nice to meet all of you. My contact info I've listed on the top here. So you can reach me at that phone number and that extension. Feel free to leave me a voicemail with any further questions you might have. Also, email me, whatever you like. So the brief description of who I am is I'm a social worker. I'm currently employed at Helping Celebrate Abilities in Johnson City, New York. For folks from around the state, that's in what's called the Southern Tier, which is just above the border to Pennsylvania, very close to the city of Binghamton. So my professional responsibilities in my job include providing Article 16 mental health counseling to individuals with intellectual or developmental disabilities who have eligibility through New York State. We'll get there. In-home family support services, and also assisting CPSC faculty with supporting students and families. I'm a social worker. I have a lot of different hats that I put on and I take off in a given day. So I recently graduated from Binghamton University's social work department with a master's in social work. I actually just passed my licensing exam a few days ago. So I'm just waiting for New York State to send me all of my goodies for my license number. And I previously received a bachelor's in psychology at SUNY Stony Brook. I'm from Long Island. You might be able to tell that if you have a pretty savvy ear for accents. It comes out sometimes. So I was a local when I was going to Stony Brook. And Britt and I moved up to New York State. Well, to move to Broome County, New York State, about 2.5 years ago, so that I could pursue grad school. I have a long-standing background in direct care provision. I've done a lot related to this kind of work before social work. So I was a medical transporter at a hospital on Long Island. I did ComHab work. I did behavior intervention for families and children with autism. During my graduate school experience, I did social work in a middle school up here in Endicott. I also did individual and group outpatient therapy, relapse prevention therapy at a local addiction program. And of course, I work at HCA now. And so finally, I also have a little pet project I'm working on, some research that's currently being constructed around the research project I did. It relates to how the Federal Americans with Disabilities Act actually manifests in like hospital visitation policy for people with disabilities, because for a lot of folks, it is a medical necessity and it is a disability accommodation, but not every hospital regards it as such. So that's enough about me. I'd be more than happy to talk at length about myself if you want later on. But now I'm going to pass the mic to my partner, Britt.
Thank you. So like Francis, my contact information is in the first line. You can call or text the number that is there, and you can also email me as well. Currently, I am a care manager. I'm employed at Southern Tier Connect. And in my role, primarily, like Francis, I wear a lot of hats, but I really help individuals with developmental disabilities access OPWDD services. So they would come to me after they gain eligibility, and I assist them in getting some of the services that OPWDD offers. I graduated in 2021 with a master's in education, but decided to go back to school to pursue a Master of Social Work. So I'm currently doing that at Binghamton University. I also grew up on Long Island, but moved to Broome County in 2021 with Francis. And throughout my years, I've had a diverse background. I've always done direct service provision. I taught as well, but I've always worked with individuals with developmental disabilities in all of the roles that I've held. So first, we're going to cover what are family support services. And according to OPWDD, family support services provide programs and supports to help families keep their loved ones with developmental disabilities safe and living at home. Now, it's important to note that programs vary from region to region, and they also vary from organization to organization. This is a general idea of what they might include. So some of these things are advocacy, after school programs, behavioral support, crisis services, family reimbursement, family counseling, training, information referrals, parent and sibling support groups, recreation camp, respite, service access, social skills training, specialized equipment, home modifications, and transportation. But it depends on the organization, how they want to implement their specific FSS program. So this kind of takes me to the next bullet, which is that OPWDD oversees family support services, and there's approximately 600 nonprofit agencies across New York State that have FSS funding, but each organization chooses to do their FSS program however they wish to. So it's really important to just kind of reach out to organizations in your area that might offer FSS and see what their program consists of. And there is a list of FSS organizations on OPWDD's website, but we'll provide the resources at the end that have all of that information for you. Also, so this is just what our family support services continued. Each of New York State's developmental disability resource offices, they have regional offices. They have local FSS advisory councils. Now, these advisory councils consist of people with developmental disabilities and their family members. And the advisory councils really work alongside state employees, so to design, implement, and oversee programs that respond to the needs of families. So OPWDD really wants to hear from the families and the individuals who have developmental disabilities to see what they want and what might be helpful for them. And that's the whole point of these advisory councils.
So additionally, like for example, just to give some context to all of this, because that was a lot, the organization that I work for, Helping Celebrate Abilities, is a nonprofit agency overseen by OPWDD for reimbursement for services that provides in-home family support services. I cannot say what they're going to be in the future because we submitted a new work plan in September to New York State, and that outlines what services for under FSS reimbursement we're able to offer. But in the present, I have done a lot of in-home family mental health therapy, family mental health counseling, and also resource management, some case management as well as an intervention for families. Because again, the goal of all of this is to maintain as stable and satisfactory of a home environment as can be for the individual that has the developmental or intellectual disability identified by New York State's Office for that. And so there are a myriad of different services that can be accessed, which we can talk about later on if you want to, but for the time being, FSS is kind of different in that way. And so the nature of the services depends on the organization, like what resources they have and what staff they have and what skills they have, and also who the family is and what their goals are, because there might be several organizations that offer different kinds of FSS in your neighborhood, but you would be in contact with those depending on what you were looking for. And you would find out about that based on the list that Britt had mentioned, which we're going to provide at the end. So no two families of this are the same, of course, and not everyone is going to have the exact same intervention based on what is offered through FSS. So I just wanted to clarify that a little bit. I might provide FSS services, does not mean somebody else who has the exam background as me is going to have the same experience in providing FSS, because it depends on, again, the FSS Advisory Council, what the families have outlined as their local needs and what is available in your area. Which brings us to the next slide. And that's going to be, why might you even want family support services in the first place? A lot of reasons, as it turns out. So in contrast to Article 16 clinical services, which I mentioned, that's also done. That is in clinic mental health counseling that is covered through Medicaid and built through Medicaid that folks might have granted through OPWDD eligibility. FSS, however, is designed to help families meet needs that are more focused on navigating particularly difficult circumstances in the present, in the now. And so because of that, these services tend to be goal-oriented and solution-focused in helping families ensure that their goals can be met. It adds another team member to assist the caregiver or caregivers in maintaining home stability. And I specifically say caregivers because many folks who have a disability of some kind don't actually live with their biological parents. They might live with found family. They might live with a sibling. They might live with grandparents, cousins, aunts and uncles, all kinds of folks. And so when I mentioned a few minutes ago, no family is exactly the same. FSS is designed to help support and allow for families to handle current circumstances to get into potentially more long-term service programs in the future through OPWDD as well, considering they have eligibility for such things. So it also gives providers a chance to meet with families where they prefer to. Like, for example, I do in-home. It doesn't necessarily have to be in clinic per se, but it was intended to be short-term and solution-focused. So that's not going to be forever, of course. It is a way of helping navigate now and the close future, I would say. So this person-centered approach is useful if there are barriers in the way of things like travel, which we can help to get around, help to develop some basic skills right now, maybe point to local resources, access things through the state, a whole bunch of stuff. And caregivers are directly involved in this. It's not only involving just the member who's eligible, but rather it's a more team-oriented approach to problem solving because the family is the primary environment that the individual is exposed to on a daily basis. Those are their people. And so we're gonna try to involve all of their people in finding a solution to whatever is going on currently. Some additional benefits also, FSS providers, many prioritize planning for transition of care, as I mentioned. Could be figuring out what resources can be accessed in the future, helping families to practice skills. It depends on who the family is and what organization is working with them at the time. Services may act as measures to help manage parts of a family's circumstances that can be resolved by just adding some temporary extra support to get over that hump. Teamwork makes the dream work, as you all know, and reaching an extended period of stability at home can be difficult. That's valid. This is not a fix-all by any means. Nobody has a magic wand. I certainly don't. But there is a long, ever-growing list of things that can bring people stress. And it's perfectly reasonable to be stressed out about stuff. That's why our body lets us know. That's why we're on edge. That's why we have difficulty sleeping, you know? So what this is designed to do is exactly in the name, is services to support families. That's what we'd like to do for you. And I speak not only for myself, but any provider of FSS services.
So who is eligible for FSS? In order to be eligible for FSS, an individual must have established eligibility for OPWDD services and reside at home with one or more non-paid family members or non-paid caregivers. The person does not need to be enrolled in Medicaid in order to be eligible for FSS. So consequently, they also don't need to be on the OPWDD waiver, but they need to have OPWDD eligibility, which I'll cover further in another slide. And to find out more information about the available family support services in your area, you can call the FSS Advisory Council at that number or visit OPWDD's website. So this brings us to how can a person get OPWDD eligibility? I'm going to try not to go too far into it because honestly, that could be a presentation in itself. But like I previously mentioned, In order to access family support services, a person must have established eligibility with OPWDD. And in order to establish that eligibility, you have to contact the info line, which we shared down here, where it says front door office for the Southern Tier and for Central New York. It is the same, and I should have clarified this in the slide, but it's the same number. It's that info line number, regardless of the region that you're in New York State, because what will happen is you'll call this info line and you would tell them, I'm looking to get service, OPWDD eligibility. And you would say, I'm from so-and-so county, and they would transfer you to the county that, the regional office that serves the county that you're in. So once you would contact the front door, you would be assigned a front door liaison, and they would assist you in moving through the eligibility steps. I hope that wasn't too confusing. What I can really just say from this slide is call that info line that's listed and tell them that you're looking for eligibility. And like I said, they will transfer you to the appropriate regional office for your county. And then you would be assigned someone to help you move through that process. These are some of the helpful resources that we mentioned. I'm going to, at the conclusion of this presentation, I'll copy these links and put them in the chat. That way you can open the links easily that way, instead of, I wouldn't expect anyone to write these down or try and remember them. So I will copy and paste these links in the chat. And these are some of the links we were talking about that have the FSS providers in the area, and some of, about eligibility for OPWDD. That's another resource here. So like I said, I'll post that in the chat.
So now we've got a couple of questions that folks decided to submit when they registered, which is great. And so what we're going to do is just briefly address some of the questions that have previously been submitted through the registration process. And if our answers to those don't cover some other questions as well, which they probably won't, because I'm sure folks have plenty of questions, we're going to leave some time after this to ask open-ended questions as well from anybody who hasn't had their questions answered so far. If you need us to go back, if you need us to recover anything, clarify, by all means, we will be more than happy to do so. And we're just going to take these one at a time based on the different strengths and skills that both Britt and I have, from the care management side that Britt has, and from the clinical services side that I have.
So the first question we have here is WIPES coverage through the Family Reimbursement Program. Medicaid doesn't cover this. Why wouldn't WIPES be covered by the Family Reimbursement Program? So the answer I can say for this is that if the person has an incontinence issue, it would be important for the family to have a conversation with that person's primary care doctor and get a prescription for wipes or pull-ups or gloves, and then Medicaid would cover it that way. For some reason, those items, personal care items like that, are not covered through FSS. I don't know why. That's something that, we would have to, you'd have to have a conversation with OPWDD about. But if you are looking for wipes or pull-ups, gloves, anything like that, what I can recommend from the care management perspective is to speak to the primary care doctor, see if that's something that they can write a prescription for. And if they write a prescription for it, which I've had members, I've had them do that. If they write a prescription for it, it can be covered then by Medicaid. So I hope that answered that question. The next question we had is, I am a support broker. How can I help participants utilize their self-direction budget to purchase family support services? This is a loaded question but what I'll preface it with is family support services are not available for purchase per se. They can work in conjunction with a self-direction budget, but most of the time, OPWDD wants to see that the self-direction budget could not cover whatever it is the family's looking for, and then they may be willing to cover it with the family support services. The other thing that's important to note here is families are allotted $3,000 per year for family support services. But that's something that you have to ask for. And if you have a care manager, they would be able to help you in navigating the family support services. If you don't have a care manager, I would recommend reaching out to the specific agency that you're hoping to get family support services from and see if they have someone that can navigate and help you, because a lot of the times they will have someone who can help you navigate those family support services. So I hope that answered your question. I'm sorry, it's a lot. Self-direction is a whole nother beast, and they can work in conjunction with each other, but family support services are not necessarily available for purchase. So yeah. And Francis, I think, was going to take the next question.
Yeah, so the next one is a very good question. How has FSS changed over the years? How has the role of parents on FSS councils changed? So that's a great question, and that's right up my alley, actually, because it touches on a lot of the professional work that I like to do, which is helping families become involved in shaping and having their voices heard regarding the policies and programs that are offered to their family members or even themselves. And so how FSS has changed over the years, I think generally the right answer to that is that I think that it's being encouraged for families to take part in these family councils that shape the nature of services in their area. Because I think some other folks will not be able to corroborate this, but I'm going to go ahead and guess that not nearly as many people know about family support services as we would hope for. And so given that we have a small number of folks who even know what FSS is and might be interested in it, we have an even smaller number of folks who would take part in the council at this point. And so the goal, one of my goals and one of Britt's goals in doing this presentation would be to increase access about family support services that you have as a viewer, and therefore hopefully spreading even just a little bit of the word about family support services to family members or other providers that you know. So that way we can continue bolstering the role of family members and caregivers in shaping family support services and potentially lobbying for an increase in services and or funding. Because really, as I mentioned earlier, teamwork makes the dream work. And so I would say that generally development and participation is growing. That's probably how FSS councils have changed. And the role of parents are becoming more involved. And I'm grateful for that. And there's still more room to do so.
So the next question we had gotten was, how do I get an increase in respite hours through FSS? What is the maximum amount of hours allowed for respite hours? Now, FSS doesn't count respite hours per se. What happens is, like I was stating before, you get allotted those $3,000, and however much you choose to pay your respite worker will determine how you're reimbursed and how much you're reimbursed for. Because remember, the respite hours through FSS, it's a reimbursement program. It's not an hours count like the waiver is. So it's just important to note, like, some agencies who do the respite reimbursement will only pay up to a certain amount back to the family who who's getting the respite and who is paying the respite worker. So there isn't, like I said, a maximum amount of hours. It's a maximum amount of the $3,000 that you are allotted. And then however much that agency that you're working with is willing to reimburse you for. Because again, it is a reimbursement program through FSS. It is not in hours per se. So I hope that made sense. If it didn't, please put it in the chat, ask more questions, because I can definitely try and better explain it for whoever would need it. The other question we got is rental assistance. Is that different from FSS, and how do I get it? So FSS does not cover any sort of housing, bills, property taxes, anything like that. They will not cover that. There are housing assistance programs through OPWDD. It is called the housing subsidy. And then of course there is Section 8, which is available to people who are not on OPWDD. But if you have OPWDD eligibility, a housing subsidy could be available. But FSS does not cover any housing utilities or anything like that.
Great. So that's all of the pre-known questions that we had. We did have some other ones that were kind of similar, and we just kind of crammed them in because ultimately it would probably be the same exact answer. But if we did not answer your question, you did submit one through the registration process, please feel free to drop that in the chat as well. I'm going to take a look at the chat here and see what we've got going on, see what other questions we might have as well. So what is the hourly rate of respite? I believe you kind of touched on that, Britt, a little bit before.
Yeah, so like I said before, it is a reimbursement program. So there is no hourly rate. The family can decide to pay however much they want, but they need to find out first from the FSS provider how much they would reimburse you for. Because each agency who provides respite reimbursement will cap it at a certain amount, but it just varies from agency to agency. So it's hard to say for each agency.
Yep. And so the following question we have is it possible to get the names and contact information for the local FSS councils across the state? Yes, absolutely. That should be available online on OPWDD's website. And when we drop all of the links to everything after we get through the questions and comments section, you should be able to see on the OPWDD website how to contact local councils. They'll have a section for how to contact the front door, what services are covered, but we're going to send all that to you as well. And we really encourage you to poke around the OPWDD website and get some phone numbers for folks that you can call, right? Because the way that the state works a lot of the time is you call a number and then they direct you to a different office or different line or different regional location based on where you're from, what you're looking for. And so it'll be really difficult for us to have on hand all the different numbers you're looking for, but you should be able to find them and save them to your computer or write them down or what have you based on whatever your needs are and what you're looking for. I hope that helps.
Went ahead and insert the link also to the local regional offices for FSS in the chat too.
Lovely. Thank you so much, Nancy.
Sure.
So the following question we have, is funding different per county? Why does Nassau not have funds for activities eligible for OPWDD, but under Medicaid coordinator? I can't really find any answers on funding. Any immediate thoughts, Britt, on that one?
Yes. So when you say is funding different per county, I'm not sure if you mean for the individual or for agencies, because for the individual, anyone who has OPWDD eligibility is eligible to receive the $3,000. Now, if you're talking about the specific agencies, I'm not sure if funding is different per county. I really think it depends on the agency and what they want to do with their FSS program. But it really depends on the agency, honestly.
I think it's definitely something that to be asked to the Nassau County office, because they'll be able to answer the question of, well, do they do things differently, and are there any things going into this that I might need to know? Sorry if you've already tried that, you may very well have. That would be my best guess, is to just be persistent and trying to find someone from the Nassau DDRO that would know exactly the details that you're specifically looking for. But feel free, if that doesn't clarify, feel free to drop something else in the chat as well. The next question that we have is, what is covered by family support services? Another great question.
Yeah, great question. I am going to actually pull up the link right here. Hold on one second. Because OPWDD has actually created a allowable and non-allowable items document. Can you see that, Francis?
I can see it, yep.
Do you need me to zoom in?
That should do, yeah.
Okay, so right up here where I'm highlighting is all of the allowable items under family support services. So there's recreational activities, programs, equipment. And like I said, this will be in the chat, so you'll be able to see it. But there is also more recreational activities here. These are some of the sensory items that may be able to be covered by FSS. And then it says here, items or services that are not covered or available through other means and are reviewed and approved by the committee. Respite, camp, electronic devices. But you'll see on here, and this, I don't know if I put the AD yet. Okay, I'll have to check, but I might be able to put, they're saying here, see section G of the ADM, because there are some exceptions and stipulations, which I can post that in the chat as well, so you're able to compare both. And then, clothing as necessity. So those are all the allowable items. And then they also have the non-allowable items here. Mm-hmm. So like you'll see, I mentioned before, the healthcare and personal care, because, some of these can be covered by Medicaid, and that's a lot of the stuff that they won't cover.
That's where the wipes are that we mentioned previously.
Yeah, the wipes, household expenses, right? Like if, your AC breaks or something like that, they won't cover that. Furniture, mattress, things like that. And then travel and transportation, fiscal expenses, like I mentioned, the housing costs and those things. And then duplicative expenses. So things that might be covered by the waiver or other OPWDD services, they may not cover. So that is the allowable and non-allowables list. I will share that in the chat so that you guys can look at it and, have it for your reference.
Awesome. So the following question is the $3,000 that you'd mentioned to buy FSS or for the FSS voucher reimbursement program? I think it's kind of like a deductible almost in an insurance company in a way. Like they will reimburse you for services up to a cap on respite, and then basically after that point, they will no longer reimburse the family in a particular annual window. Does this sound about right, Britt?
Well, that makes sense, yeah. But also it's important to note that the $3,000 is not only for respite. The $3,000 covers everything that encompasses FSS. So that's the respite reimbursement. That's the items that I just showed you. classes or memberships that might be covered, anything that was in the allowable and non-allowable list. What was in the allowable part of that list is what the $3,000 covers. So it's not only the respite reimbursement program, you have to divvy out that $3,000 for everything relating to FSS. So that could be items, sensory items, could be classes or memberships, could be the respite reimbursement. So it really just depends on the family situation and what they're looking for specifically.
Yeah, it could even be in home services like I do for folks.
Yep.
You know, you have the $3,000 cap. I believe it's an annual period. Is that true?
Yes.
Yeah, in an annual period, and then the families can shape what resources and or services they might want that are available in their area based on that given amount in a particular 12-month period. So let's see, what else have we got? I can't find the list of FSS regional offices using the link. Could you please clarify? Nancy followed up, what region are you looking for? And it was clarified, Suffolk County / Long Island. So hopefully that should, oh, go ahead, Nancy, I see you. You're muted. I'm not sure if you want to say something. I just wanted to give you space to do so. If you
Oh, I can go ahead and put that in. It's actually for Long Island, so we'll put that in the chat.
Thank you. So the next question is, what agencies now charge for recreation? Well, that's a tough question. It depends on where you are. That's why it's hard for us to answer that because, like, yes, we're from Long Island, but we didn't really begin to become familiar with services on Long Island while we were living there because we've lived up here for 2.5 years. So we could probably give you the skinny on some local stuff in Brim County. But other than that, you would probably want to look for the general information on Long Island number that Nancy just posted in the chat to find out exactly who might be able to offer recreation reimbursement under FSS. So the next question, what calendar does FSS follow? Is it fiscal year from July to June? That's a great question. I don't know the answer to that. Britt, do you know the answer to that?
It depends on when you were approved for FSS.
So it starts at the approval and that's the beginning of your year?
Yes, from what I'm pretty sure, but I will find out and maybe put it in the PowerPoint before Nancy sends it out. But I am almost positive that the fiscal year would start when you're approved for the amount that you're approved for.
Mm-hmm. Okay, so let's see what else we've got here. Is sensory OT included in OPWDD? That's probably waiver stuff. Does that sound about right to you?
Oh, that's a really tough.
Yeah, I figured as much.
It's a great question, but what I'll say is if the sensory OT is for a child that is in school, the OT would be expected to be covered by the school district. They also won't, from what I'm pretty sure that FSS wouldn't cover sensory OT, and especially if it's for a child, because like I said, if they're expected to be in school and getting OT during school, it wouldn't be covered that way. And also, to follow up with that, if you have Medicaid or private insurance, if the school wasn't able to do it or you needed extra, it would be advised that you try and go through the insurance first, because most insurances, if there was a justification from a primary care doctor, would cover that.
And even with eligibility that comes from Medicaid, that's the same thing still applies as well. They have state programs which would be under Article 16 clinical services, I believe, that would include sensory occupational therapy after a given evaluation of the necessity of such services, right?
Yep.
Yep. And so the final question that we have so far, I hope that helps. If we kind of missed the mark on answering a question, please let us know in the chat. You have our time, you have our our attention. So however we can possibly help you, we'd be more than happy to do so.
Also, you can unmute. I don't want to. I like if it's easier to talk and talk something through, that's totally fine to unmute as well. We'll just get through these next questions, and then if anyone wants to unmute and explain further or get some more clarification, please just let us know.
Yep. So the final question we have, all FSS now charge, question mark? I'm kind of confused as to what's being asked per se.
So Barbara had asked originally, so agencies now charge for recreation, and then she followed up with all FSS.
Gotcha.
Yep, now charge. So it doesn't, so it depends, like, so if you're looking for recreational stuff through FSS, what that means is you're looking for an agency that provides recreational activities. And I think this is what you're meaning, Barbara. If I'm wrong, please tell me. But what I think you mean is if you're looking for an agency that it provides recreational activities. So for example, up here in Binghamton, we have Stable Movements, it's called, and it's a horse therapy program. FSS will cover X amount of classes, let's say 10 classes, for a person who has OPWDD eligibility. And what will happen is the parent or caregiver will pay outright for those classes and then be reimbursed for the classes. So say they do 10 classes and it comes out to $500 for those 10 classes. The parent or caregiver will pay those $500, and then they will send the receipt or proof that they paid that to the provider, the FSS provider, and they will send back the $500 check to reimburse you. So it's not necessarily that FSS is charging. At the FSS, when I say FSS provider, I mean the agency that is providing the reimbursements for goods and services. So for like example, Francis's position at HCA, the parents don't pay outright for that. Francis comes into the home and does his services, but the families don't pay outright for that. But for recreational activities, they would be paying outright and then be getting reimbursed for those. I hope that covered it. It's very confusing. I apologize, but I hope I covered what you were asking.
And then Barbara followed up as well by saying, if an FSS provider has no fee, is OPWDD eligibility all that's required? I mean, yeah. So earlier in this, if you want to scroll back real quick to our slide about that, OPWDD outlines 2 specific criterion for I don't want to use the word eligibility because potential use of FSS. And so that is eligibility for OPWDD coverage as identified in New York State as having an intellectual developmental disability. And you must live full-time with an unpaid caregiver. And those are the 2 things that are required. You do not need Medicaid for FSS. A lot of folks have it regardless, but it doesn't specifically say that you need Medicaid to access FSS because there are other services that Medicaid will explicitly cover as well that are needed. And that's when I mentioned earlier in the slides about sort of helping folks navigate a weird gap in whatever a need that might be felt by the family member or individual. FSS can help families navigate that while covering some of the gaps that aren't offered through other OPWDD eligible services that are more formal, like community rehabilitation work or living in an individual residence in neighborhoods, like a full-time residence or stuff like that. That's why FSS doesn't cover those things, because there are other programs OPWDD offers that will be able to do that instead. And the reason why you can do mental health counseling through FSS is because Article 16 mental health counseling through the state requires at least one person to be in the clinic at a given time for the provision of therapy. FSS does not require that, but again, remember there's a cap on $3,000 in an annual period. So typically it's going to be short-term solution focused because it's probably not going to last you long-term. And that's not really what it was designed for in the first place, but I digress.
Also just want to mention that, so Jackie put in the chat, the fiscal year downstate is July to June. Upstate is different. The dates are included in the FSS ADM. Thank you, Jackie, for clarifying that. So yeah, the ADM I will post in the chat as well, so that that's available for you. And then someone direct messaged me and said, how do you know how much you were approved for? That's a great question. So if you have a care manager through OPWDD, or through an organization that works with OPWDD, your care manager would be able to help you figure out how much you're approved for. But most agencies, especially if you're getting those goods like sensory items, any sort of classes or memberships, anything like that, the agency that you got put the application in through would send you a letter and say, hey, this is what you were approved for. These are the items that you were approved for. You can go ahead and buy them, send us a receipt, and we'll reimburse you for it. So that's how much that you are approved for, is based on which agency that you're working with. Like I said, they would send you a letter stating how much you were approved for, what the items you're approved for, things like that. But it just depends on each family situation.
Yep. So the next question we have here is, so whether one wants reimbursement for the therapeutic horseback riding or to utilize in-home therapy services, they both pull from the $3,000 per year cap. Yes, I believe that is true. Can you corroborate that bit, Britt?
So if they want reimbursement for therapeutic horseback riding, it would pull from the $3,000. Mm-hmm. Now, to utilize in-home therapy services,
through FSS.
Like what?
Through FSS specifically.
Yes.
In-home therapy through FSS.
I don't know if it pulls from the $3,000 cap.
It's worth asking your local DDRO, that's for sure.
Yes, and like I said, I could find that out and also put that in the PowerPoint before Nancy sends it out. But I want to say that they're separate. I think it depends on the agency. I want to say that if you want horseback riding or memberships, classes or memberships, things like that, that would pull from the $3,000. But for something like Francis coming into the home to do in-home therapy through FSS, I believe it's a grant that is not pulled, that the $3,000 is not pulled from.
But don't quote us on that, though.
Yeah.
Be sure to ask the DDRO or your care manager. You might have.
If you have a care manager, yes.
Absolutely. Because we certainly we wouldn't want to tell you anything that's false or get anybody's hopes up, or potentially steer someone in the wrong direction. So that's our best guess, but definitely double check here. Absolutely. So next question. Hi, could you please repeat the 2 requirements for accessing FSS? Britt, we have a slide where it says, we've got like bolded lettering and underlining as well. Just so folks, I think it might be a little earlier. That's the one, right? So it's right there. In order to, and this comes directly from New York State, we pulled this from, in order to be eligible for family support services, an individual must have established eligibility for OPWDD services and reside at home with one or more non-paid family members or non-paid caregivers. For example, I couldn't do any family support services for someone who lives in a residential facility because, well, technically they don't live with their family, you know? So that would no longer be family support services. And there are other resources OPWDD has that are funding for the meeting of the needs of the individual in that particular setting.
Yeah. I also got a direct question. It said, if a child is a minor, can he or she still be eligible for FSS if they already have OPWDD? Absolutely. If they have OPWDD eligibility, then they are eligible for FSS. They just need to have, like Francis stated, the OPWDD eligibility and then reside at home with one or more non-paid family members.
Yep. And so hopefully that helps. Again, you do not need Medicaid. So for this specific access to services, a lot of folks who have OPWDD eligibility have Medicaid regardless for other things, but FSS does not require that. You don't need to run it through your Medicaid insurance because it's a reimbursement program, not reimbursed by the insurance company. I won't get too far in the weeds. So our next question we have is, can we submit information about program availability with you? Is there a contact list of care managers? Well, I know that the care manager or care coordination organization that Britt works for as a care coordinator or care manager only serves members in a particular locality.
Area. Yes.
Yeah. So there are plenty of CCOs around the state that serve your area, I guarantee it. It just depends on which one actually is set up to do so. So I think you will serve Broome County and then parts of some surrounding counties, right?
Yeah, so we serve Southern Tier and Central New York. But if you're looking for like a contact list of care managers, what I would recommend doing is OPWDD has all of the care coordination organizations in New York State. So for your specific area, Sabrina, I would advise you to look which care coordination organizations are in your area. And normally if you go to their website, the executive director's contact information or someone in leadership's contact information is available. And I would definitely reach out to them and see if they're interested, which I can almost guarantee that every CCO would be interested in getting information about program availability. So I would just recommend, looking for your specific area.
Yep. So the next question that we have is, can you go through more than one agency? If one agency offers educational advocacy, but not reimbursement, do you have to choose between the two supports, or can you apply to both agencies for separate supports? No, you can use as many as you have access to. Just remember about the cap and make sure that you clarify what the stipulations are about that. Plenty of folks utilize more than one family reimbursement service. Like we were talking about earlier, some folks get horseback riding if they have that in the area. Some folks also get in-home family support services through family counseling.
Yep. It's also just important to note that, you can, like Francis said, definitely go through more than one agency, but the agencies will want to know what FSS supports you already have and how much money is being used for those supports, so that they make sure not to exceed that $3,000 cap.
Yep. But other than that, though, I really don't think there's too many. There's a maximum amount of different kinds of services that you can access through FSS. Yeah. There's just a monetary cap on what the reimbursement will be. Let's see. I don't have OPWDD services, but have eligibility letter, and I don't have a case manager. What are the steps to get FSS?
So what I would recommend doing is reaching out to the advisory council that we've provided the information for, or going on OPWDD's website and going to their FSS link, because they'll have their an info line number there that you're able to call and reach out to see, because it really depends on what you're looking for, right? So if you're looking for reimbursed respite, you have to find out which agencies in the area provide that, and then reach out to that agency and they'll help you move through the process for their specific agency. But it really just depends on what services you're looking for. And if you want a care manager, I would definitely recommend, especially if you have the eligibility letter, reaching out, finding out which care coordination organizations are in your area, and definitely starting to move through that process, because it is very helpful. And I'm not biased, I'm not just saying that because I'm a care manager, but it's really helpful to have one to just help you move through these steps, because we are fully aware of how overwhelming it is.
She actually just responded, we do not currently have a care manager. That should absolutely be the first step that you take, because it is another team member that is able to help you navigate local resources and help you solve problems related to getting to services, but also stuff like helping you build a life plan for the coordination of services that you're looking for your child as well.
They also stated, Francis, that they have provisional eligibility at this point.
Oh yes, I didn't even see that. Thank you so much.
And that's fine. You're still eligible for a care manager. And I'm getting a little like, because I'm getting excited, but if you have provisional eligibility, I would absolutely look for a care manager now, because that care manager, it is their job to assist you in gaining permanent eligibility when it is time for that to happen. And that is a beast in itself. So I would absolutely look for a care manager as soon as possible, in an agency that you like, so that they can help you work through that permanent eligibility piece. Because that is a beast in itself.
That's right. And you don't want to lose eligibility you might otherwise have access to long term, because there was a gap in eligibility. Like, oh, well, my provisional eligibility disappeared. And then you would have to go through the whole process of gaining more when you already currently have access to things like the Medicaid under OPWDD eligibility services. So use the access to that to get yourself a care manager and get yourself ahead of the game. So you don't have any gaps in services and you don't need to worry about long term. Once you get that permanent eligibility, you're good. You're set. That's the big one. You get that?
Yeah.
You just have to keep up with the paperwork, and your care manager will help you do that.
I wanted to point out one question that I think we missed. Someone wanted to be sure if it says, if my husband and I both work, we do not qualify, ?
No, that's not the case. So if you and your husband work, but you have a child or someone is OPWDD eligible in your household, you are eligible for FSS. They don't count income. The only thing is the $3,000 cap, but they don't count your income. It's just that you need that eligibility piece for OPWDD to qualify and live at home with a non-paid family member or caregiver.
Yep, that's part of the equal provision of accommodations and access to quality of life through federal regulations like the ADA. It's not a socioeconomic status thing. If your kiddo has identified as having an IDD through the state, there's stuff that they're eligible for, period. Because by the very nature of having an IDD as well, they won't discriminate against you based on SES.
I also want to point out that Jackie had wrote, and I'm glad she put this in there. I didn't want to overwhelm people by saying this, but she said reimbursement for goods and services must also include clinical justification in most cases, and life plans must include information as to why the item is needed and how it is directly related to the individual's disability. As an agency providing reimbursement, we must submit those documents to OPWDD to be able to provide the reimbursement. That is true, Jackie, if they have a care manager. If they have eligibility, but they are not signed up with a CCO, then they wouldn't have a life plan to put that justification into. So you wouldn't need the life plan piece of it, but they would still need the clinical justification in most cases, especially for the sensory items. I've seen a lot of FSS agencies wanting justifications for those sensory items from the individual's OT or PT, physical therapist or occupational therapist, but that's something that you communicate to the provider.
That's right. So, so two questions actually from, I hope you don't mind me putting you on the spot. Alexander Fialos, I believe is hopefully the right way to pronounce it, Fiallos. And the first question would be, does FSS cover nursing services if insurance does not? I don't believe that they do, because now we're getting into the territory of medical services.
Yep.
And that is an entirely different ballgame. There are different routes that you can take to pursue provision of nursing services, but that should be covered by Medicaid insurance companies if it's a medical necessity.
Yeah, and I was like I said before, if you have a primary care doctor and you're worried about, like, you need nursing services or something like that, I would absolutely talk to the doctor, because that, like Francis is saying, is touching into medical territory, and FSS will not cover that.
Mm-hmm. And then the follow-up question from Alexander was, by non-paid, in reference to non-paid family members being, or caregivers, the one someone has to live with to qualify for this. By non-paid, do you mean that a person does not get paid for caring for the person with a disability? Yes, right. A family member, a caregiver who is not being reimbursed for the care that they're providing to the individual. Because then if, the person is being provided for services within their service provider, and really FSS, not to be too obvious with things, but it's family support services. So that by that point, they'd be providing services, and that's an entirely different thing. Where the goal here in providing FSS is to support families, caregivers, and individuals in those environments. So yeah, just something to keep in mind for sure. And they also must live with that person full time, which means potentially for some families, only the person who has full custody would be able to utilize in-home family services, versus someone who gets weekend visitation. I don't think that FSS would allow them to visit the home of the separate location of the caregiver who would have the person live with them part-time. Though, again, always double check. I've been wrong before, it can happen again.
Jackie also had wrote that the DDRO has denied, and for, DDROs, the regional office, has denied a reimbursement request because an individual had provisional eligibility. I have seen that also, Jackie, but I have seen individuals who have provisional eligibility and have gotten the full $3,000. So it really just depends on the FSS agency the person's working with, if they have a care manager, if the care manager can put all of the justifications in. So again, it's a case-by-case basis. It does happen. They have denied it before. But like I said, I've had individuals who have provisional eligibility and they've gotten the full $3,000.
Yeah, and then I think the last thing worth noting, unless I missed something, Lucy Brady saying, I can't find an actual list of contact info for the FSS council chairs across the state.
Yes. May I jump in?
Of course, please do.
Hello. So I've been in, hello. This is very great. This is very informative. I've been on my family support council probably for the past 20 years. I'm seeing lots of changes. Sure. Things that were, easy to get in the past is becoming a bigger challenge for families. But one of the things that we cannot get access to is the contact information for the other councils, so that we can kind of all work together, or sometimes we have people who may come up here, but they actually live in another area of the state. And it's very hard. I went on the website numerous times, but there isn't a spot where it'll give you information solely on FSS councils around the state. So that's why I'm asking, because it's something that's so needed. We're don't quite understand why it's so top secret, when in fact, we all would just love to work together statewide. So that's the only reason I'm
Sure.
asking.
Thank you for clarifying that, because that information only comes from someone who's been on the family council. So I
Yeah.
appreciate that.
Yeah.
It's
Have you
interesting. I wonder if
tried?
it's as
Sorry.
simple as something as an oversight. I'm not sure, but someone's got to know. Even if it's your local DDRO, who might be able to point you in the direction of a representative from a different region. No?
They're not giving the information.
Huh.
So,
Okay. Well, thank you for
Yeah.
letting us know. It seems like
Yes.
there's some work to do to build
Yes,
those
please.
bridges in, huh?
Yeah, yeah, that's definitely something, because I wasn't aware that they weren't giving the information.
Mhm.
That is something that I'm definitely going to take to the executive director at our organization, because they have more information about the FSS councils for our region. So if we could get, because Lucy, are you in Long Island?
No, I'm actually in upstate. I'm in
Where upstate?
I'm in Albany, Schenectady.
Okay. So
Capital
then,
region.
yeah. So if
Yeah.
I could even get contact information for someone in Southern Tier, Central New York area for the advisory council, then that's a conversation that I'll definitely have with our directors, just so that we can start working. Because like you said, there really needs to be more cohesiveness going on.
Yeah.
So yeah, I will definitely do that. Would you be comfortable, Lucy, private messaging me your contact information?
I would love to.
Okay, yes, please do.
So how would I do that?
So you go to the chat.
Okay. Oh, okay.
Yep,
Yep.
and then you would just pick my name. You don't have
Gotcha.
to put it to everyone.
Okay, I got it. Thank you.
Yep.
I'm wondering if we have any other folks by chance who might be a member of one of the councils as well in that region or a different region, just out of circumstance. If not, that's okay. Thought we get lucky.
I'm just looking. Oh, yep. Someone said, is there an age limit to apply for FSS services? There is not. You just have to be living at home with a non-paid family or caregiver. So we have some people that live on their own. In that case, they wouldn't qualify because they have to be living at home. Just looking here. I don't see any other questions. I want to make sure we didn't miss anything.
Do you think this is a good time to drop the links in the chat?
Yes, I will do that.
I can do that because I think you're sharing
Oh, yeah,
screen.
yeah, that would be good. Thank you.
Sure.
One person said, Brittany, I thought was interesting, that if you submit your requests to multiple agencies, that the reimbursement process will be much slower.
Yes, and that is true. The reimbursement process, in all transparency here, is slow to begin with. So yes, if you do use multiple agencies, it may take a bit longer to receive that reimbursement. So I would definitely be wary of that.
Yeah. Anyone have any additional questions? This has been a wonderful presentation.
Thank you. Thank you
I
so
hope
much.
it wasn't too overwhelming. But yes, but we also have our contact information right here. Please write it down. Please save it, because at any point, if you think of something tomorrow or at a later time, we really encourage you to reach out to us. And if we don't know the answer, we will certainly forward it to someone who can answer it for you. We have a pretty wide network of people in our area. So absolutely, please save our number so that you can contact us at any point.